regardless of if that is law enforcement, emergency medical services, fire services. To prepare for any of those interactions, there are certain things that we need to do ahead of time. Certain information we need to gather, certain skills we need to practice. And so that's really what we focused on with this training. We're going to start with kind of an overview of why individuals with autism may experience crisis and therefore interact with first responders. We're going to look at community crisis services versus first responders, who to call and when. And then we have some concrete resources and tips for preparing for crisis and potential first responder interactions. And I've also given the Autism Society some of the things that we talk about, some examples of the forms, so that y'all can start utilizing them, modifying them, creating your own resources after this. So first we'll start with why individuals with autism may experience crisis. When preparing for potential interactions with first responders, it's really important to begin with gathering information ahead of time of why a person might interact with a first responder, and especially why your loved one or yourself may interact with a first responder. And to do that, we're really going to take a biopsychosocial approach, which means we're going to step back and look at the whole person and look at different areas of their life and the factors or stressors or risk factors that could increase the likelihood that a person has an interaction with first responders, or might be more relevant to explain why a person is currently experiencing a crisis. Another reason why it's important that we take that biopsychosocial approach is because it helps the individual or their caregiver advocate for the most appropriate intervention during a crisis. When first responders interact with us, if they don't fully understand the whole picture or what might be contributing to that crisis, they may have a really hard time identifying the best approach, the best intervention to support that individual in seeking. And so it's really important as caregivers and those that support individuals with autism diagnoses that we are prepared to give as much information as we can during that crisis so that that first responder is able to respond in the most appropriate manner. The other reason is because of something called diagnostic overshadowing. Diagnostic overshadowing is the tendency to focus on one diagnosis while ignoring other more relevant diagnoses or reasons or factors that might be behind the person's behavior or the current crisis. For individuals with IDD and autism, a lot of times their IDD and autism diagnosis becomes the more prevalent explanation. And all behavior starts to be viewed through the lens of that autism diagnosis. However, there's not a whole lot of interventions for a first responder if the only reason for the behavior that we're seeing is autism. And a lot of times, those of us that support individuals with IDD and autism, we tend to focus on the behavior. That's one of the modalities that is very prevalent with supporting individuals with autism. And so we tend to define everything in terms of behavior. And so in our trainings with law enforcement, I've had a lot of feedback from officers that say, you know, a mom called 911 and we came out and the only information that we had was that Johnny was having behaviors and that Johnny had autism. And we weren't really sure what to do because that autism is not really treated at the ER or the psychiatric hospital. So we really didn't know what to do with that information. So it's really important as we prepare for potential first responder interactions that we are helping that first responder see the whole person and advocating for the whole person and what might be the more relevant explanation for this crisis so that the most appropriate intervention can be explored. So the biopsychosocial approach refers to biological, medical, psychiatric, psychological, and then social. So first we start with the biological medical. Before a crisis even occurs, before we even interact with or think about calling first responders, we should sit and think about what are the medical diagnoses or biological factors that might decrease a person's ability to cope with stressors, increase their risk of harm, or lead to a potential first responder interaction. And we know from a lot of the research out there that individuals with IDD, including autism, experience medical and physical conditions 3 to 4 times more frequently than those with IDD. So because they experience co-occurring medical diagnoses more often, that could be a much more relevant explanation for why somebody is needing crisis services or emergency services. So it's important to ahead of time kind of sit down and put pen to paper. What is your loved ones? What are your medical diagnoses? What medications are you taking to manage those diagnoses? Are there any side effects to those medications that could reduce a person's ability to cope or lead to a medical crisis? A lot of psychotropic medications and medications that individuals with IDD may take could be incredibly constipating, which could really diminish a person's ability to cope with stressors, increase the likelihood that they react to stressors with a fight or flight response with increased risk of harm. And it also increases the likelihood that they're going to experience a medical emergency. So it's really important that we have an understanding of those factors that could be going into it. It's also important to look at, especially in the moment, has the person experienced a recent injury or are they in pain? It's important to remember that behavior is communication, and could pain be something that they're trying to tell us is going on? The other reason that it's really important to also look at the medical and biological factors that could increase the likelihood of crisis is because individuals with IDD and some individuals with autism are at much more increased risk of very serious complications, including death, for something that's known as the fatal 5. And so constipation and bowel obstruction and GERD, aspiration, seizures, dehydration, sepsis. If your loved one has an open wound on their foot, that increases the likelihood of infection, which increases the likelihood of sepsis. So it's really important to be paying attention to that whole medical component of it. Not only kind of preventative and what are those ongoing conditions, but what also might be happening in the moment. We also want to gather information about any psychological or psychiatric factors that could lead to a crisis or potential first responder interactions. Individuals with IDD and autism also experience mental health diagnoses, complex mental health diagnoses, at much higher rates than the general population. Much more likely to be diagnosed with a mood disorder or anxiety. And so it's important that we factor that in. Going back to diagnostic overshadowing, sometimes we don't take into account somebody's psychiatric symptoms and how that might be impacting the crisis. And if somebody is really experiencing a psychiatric emergency, psychiatric services are what's needed, and we need to be able to advocate for those. So it's important to know your and your loved one's diagnoses and practice being able to share that information. We also know that certain diagnoses present differently in individuals with IDD and autism. Mood disorders are much more likely to be associated with increased irritation and agitation and increased aggression. And so if all of a sudden you are noticing your loved one who has bipolar disorder or who has a depression diagnosis is all of a sudden has an increase in irritability, an increase in agitation, that could be a potential psychiatric crisis. And so it's important that we're able to kind of make those connections and then share that information forward. Again, we want to know what those medications are. It's really important to keep an updated list of the current medications. We'll talk about why later on, but it's really important to know currently what is somebody taking, what is the dosage, what is the frequency, and how do they take it? And then again, looking at, are there any side effects of that medication that could be related to the crisis or lead to crisis? Have there been any changes in psychiatric symptoms? Could there be an explanation for what's going on in the crisis that's related to decompensation or deterioration? Have there been significant changes in sleep recently, appetite, agitation or irritation, depression symptoms, suicidal, homicidal, self-injurious behaviors or aggression? Auditory visual hallucinations. Some folks may experience any or all of these at kind of a normal everyday baseline, but that's just kind of part of how they navigate the world. But if we start to see a sudden increase in intensity and frequency, it could be an indication that this is a psychiatric emergency, and that's information we should share. And then also, does the person ever have a history of crisis? Have they ever been admitted to a psychiatric hospital? What was their response to that? And then also, how could trauma be impacting a person's behavior as well? And then we also want to look at social environmental. I'll be honest, a lot of times the social environmental factors and stressors, especially for individuals with autism and IDD, they kind of tend to be the most things that we look at, the first things that we look at. And sometimes we start to provide interventions at each of these points when there might be something else going on as well. So all of these things could lead to potential first responder interactions in and of themselves. But also a person could be experiencing all of these and be experiencing a psychiatric or medical crisis. So that's another reason why it's really important for us to prepare ahead of time to know what those psychiatric and medical stressors could be. And in the moment to kind of review those and think about those and how it relates to the current crisis. Because somebody who's experiencing a psychiatric emergency, again, their ability to cope with stressors is going to be greatly diminished. And their ability to cope with any one of these social environmental factors incredibly diminished. So it could be a combination of both. And if we only focus on the sensory over and under stimulation, or the difficulty expressing needs, or the extreme dependency on others, those are things that need to be addressed as well. But if we ignore the fact that this person is also experiencing a very serious medical or psychiatric emergency, we might miss a really important intervention to help the person feel better, to resolve that crisis, and hopefully prevent the crisis moving forward. And now I'm going to hand it over to Marissa, who's going to talk about community services versus first responders, who to call and when.
Thank you, Sarah. So when I'm going to go ahead and just talk about some local resources here that we have in Travis County as a way to provide some information and education about alternatives to calling 911 systems and in ways crisis services can assist in helping support individuals through a crisis episode and linking to back to their services that they're already engaging in, and or getting them connected to services that they might have barriers or challenges to. So it's so important to ensure that we're utilizing our resources as best as possible and really focusing on and making sure that, you know, the expertise of individuals going out and responding to people in crisis is utilized as best as possible. So reserving law enforcement if there's a public safety issue, fire if there's a fire issue, EMS if there's a medical emergency issue. And Sarah was talking about the co-occurring issues that happen with individuals, and that happens very frequently. So it's really looking at what is the most pressing and imminent safety concern at that time and figuring out what that resource looks like. Here in Travis County, we do have very fortunate to have a pretty robust crisis response system where we do have co-response options that I'll give you information about. But looking at when to call 911, we really want to reserve that if someone, due to their mental health state, is acting out or their behaviors, and there's an immediate threat of danger to that person or someone else. Here in Travis County, we also have 4 options when someone calls 911. So that began in February of 2021. And I'm very happy that that is something that our community has access to, because it gives people the option to self-identify that there's a mental health or behavioral health concern. And it also provides an opportunity to reduce stigma that a behavioral health crisis, whether that be someone who is experiencing a diagnosis related to mental health or developmental disabilities, has an option to get expert care in that from that profession, as opposed to, getting medical emergency services or public safety services when that might be not what they need at that time. So when you call 911, you hear the option, are you calling for police, fire, EMS, or mental health services? The 911 operator in our system is the Austin Police Department, who does that initial triage. And whether or not you pick mental health services, they're always trying to determine what is the most appropriate service to connect people to. So you could select mental health services, but if there is an imminent risk of harm, they will transfer to police to ensure the safety of that person, as well as safety of maybe any family members or friends in the environment or the community. Also, I do want to say that if someone selects police, fire, or EMS, and within the triage questions, it is determined that there is a mental health component, they do still have the ability to transfer the call over to crisis clinicians that are on the floor. And their purpose there is to really do a screening and triage and determine what is the most appropriate response for that individual that's experiencing a crisis. Integral Care runs a 24/7 crisis helpline. If you don't already have this number memorized, I strongly encourage you to do that. Put it in your phone. It's a great resource for you and your family or loved one. It's 512-472-HELP. This crisis helpline has the ability to provide you with information about resources within our agency. If you are not in a crisis and maybe wanting to seek outpatient services for yourself or your loved one, but it also provides an opportunity to provide emotional support and triage for individuals that are experiencing crisis. Our community hotline through Integral Care is also the designated entity within our area to take the 988 calls and the National Suicide Prevention Lifeline calls. So these are options that you have, whether or not you want to call 911 or 472-HELP. I know in the moment it can be very, tricky to determine what is the best option for me to do that and who is the most appropriate person to call at that time. And I just want to strongly emphasize, if there's imminent risk, if there's any type of behaviors where someone is in danger of harming themselves, if they have already harmed themselves, that is a call to 911. The mental health option is there to provide a safety net in the event there is not an imminent risk of harm. But I would recommend that if there is an opportunity to utilize a least restrictive option and connect to a clinician who has the ability to meet with you or your loved one, Integral Care 24/7 hotline is definitely the route that you can go. They do also have the ability to directly connect with 911 if during the phone call it is determined that something has changed and there is now an imminent risk of harm. They can help support and get that connection quickly so that public safety or medical emergency can go out to respond. All right, let me see. Next slide, Sarah. So some of the services that our agency is able to provide are the mobile crisis outreach team and psychiatric emergency services. Again, these are alternatives to 911 services. The MCOT teams were established in 2006. Our original team receives all of their referrals from that community hotline 472-HELP. And they are there to really ensure that we are reducing any barriers that people have to accessing services. So very specifically, it could be transportation, financial, or lack of family support to help them navigate the system. All of the services are community-based. We also have a goal of preventing the overuse and misuse of emergency departments, psychiatric hospitalizations, and unnecessary law enforcement involvement. So in addition to the MCOT team that started in 2006 and receives all of their referrals from our hotline, there is a secondary team within our community that's called the Expanded Mobile Crisis Outreach Team. And they have the same type of goals and services. The only difference is that they are deployed out and respond to calls that they receive from first responder partners. So that includes law enforcement departments, Travis County EMS system, and then criminal justice systems as well. So we have counselors at Central Booking and the Correctional Complex to help with jail diversion and then reentry back into the community. This team serves individuals for up to 90 days. In those 90 days, we focus on crisis stabilization, linkage to ongoing care, and a really beneficial service that we do provide is a mobile medical provider on both of our teams that will help ensure medical stabilization in the community so that individuals do not have to access a higher level of care if it's not necessary. I mentioned before that our community has a very robust system, and I think it's also really useful to know that both the mobile crisis outreach team and I'll talk about PES, they do have the ability to do direct admissions to our agency's crisis residential and respite facilities. So those are voluntary placements with a focus on medication stabilization and linking to ongoing services. They have medical providers, psychiatrists, nurses, case management, and really help support the individual during their crisis episode, get connected to services or restarted on medications. Also another alternative to going into inpatient hospitalization for individuals. Psychiatric emergency services is another option and resource for individuals. It serves anybody that is experiencing a psychiatric crisis and essentially has the same goals as the MCOT team. However, it's a clinic-based walk-in clinic. Their focus is on crisis stabilization in the least restrictive environment. We also have psychiatrists and advanced nurse practitioners who can provide medication evaluations. The hours of operation there are Monday through Friday, 8 a.m. to 10 p.m., Saturdays and Sundays, 10 a.m. to 8 p.m. The mobile crisis outreach teams are a 24-hour service. I do want to also just provide information that we do have peer services at psychiatric emergency services for individuals that are in need of substance use services. So that is a new service for that program, and it has been very beneficial as well. I think that, one of the things to mention is that, again, emphasizing these options for a least restrictive option if your loved one is not in imminent risk of harm. All of these teams, the mobile crisis outreach team, the expansion team, as well as psychiatric emergency services, is really going to look at the whole health of the individual. And so we work very closely with several of the departments within our agency, and oftentimes work with Sarah and her staff if there's someone who is experiencing developmental disabilities, some substance use, co-occurring mental health, and ensure that we can help support that connection as well. So our clinicians in these programs are generalists, typically master level clinicians that can focus on crisis intervention, but do also have access to expertise in working with Sarah and her team for individuals that are experiencing developmental disabilities as well. For the 911 systems, I would recommend that anytime you do utilize them, the best thing to do is just advocate for your loved one or for yourself. The more information that you can give at the initial onset of the 911 call is going to be so beneficial for you or your loved one. And that could look like providing information related to what the diagnosis is. What are some key things that will be helpful for you or your loved one in crisis? What are the triggers that someone is experiencing or has experienced in the past? And what are some things that are helpful in crisis situations? So those are recommendations to utilize when you do have to access the 911 system for your loved one. Next slide, please.
Okay, that's back to me. So thank you, Marissa. And so I really think one of the crucial things to take away from what Marissa shared is, one, your community has MCOT, has a local authority, and likely also has very similar services. So a lot of what she talked about can possibly be found in your community as well. You may just need to call your local authority and find out exactly what the hotline is for your area, what services are available in the moment, what services are available for ongoing, if you were experiencing a crisis. The other thing about community-based crisis intervention services is that they are voluntary and they are a lesser restrictive intervention. So Marissa's point about if somebody is actively engaging in aggression, actively engaging in self-harm, or is at imminent risk of doing so very quickly, might escalate into doing so, MCOT's not going to be an appropriate intervention. It really will be important to call 911 and either ask for a mental health officer or even potentially medical services, which is another reason why it's so important to have kind of an understanding of what you or your loved one's diagnoses are, how that might present, so that you can start to access the most appropriate intervention from the beginning. And like Marissa said, the more information that we can share, even when we call 911, the best. Many of the officers that we provide training to say, it would have been nice hearing this information on my car ride over, that this was an individual with autism. It would have explained everything that I was seeing very differently. And so, because a lot of times they're having to take into consideration certain safety factors, they're getting information possibly that doesn't really make sense to them in the moment for what's going on. Emotions might be really heightened. And so being able to understand that this is a person with an autism diagnosis, these are one or two things that you can do to help de-escalate. These are one or two things to avoid, can be really, really helpful even when you're calling 911. The other team that I wanted to touch on is IDD Crisis Intervention Specialists. This is a team that Integral Care has, as well as many other local authorities across Texas. It provides short-term, up to 90 days, crisis prevention services that include linkage to ongoing services and supports. So this team can help set up with psychiatric services if need be, and make referrals to those and help through intakes. Be looking at other services and supports that, if they were built into place, could help the individual prevent going into crisis in the future. And so they're really going to kind of look at what are those gaps in services, what are those areas of need, and how can we start filling them. They also can provide therapeutic skills training for individuals and caregivers. Oftentimes for individuals, it's practicing coping strategies. And for caregivers, it's how to do a lot of what we're talking about right now, identify the risk factors that might lead to a crisis and first responder interaction, and some points of prevention and intervention along the way. They can also assist with safety planning, which we'll talk about in a second. And a big part, Integral Care is contracted with the state to provide the service, and a big part of our contract is to support MCOT. So like what Marissa was saying, we can co-respond to them. They often reach out after a call to get more clarification. Our services, MCOT has a bit more expanded hours and ability to kind of provide coverage for the county because they're a bit bigger of a team, but they've all received training on the unique needs of individuals with IDD, including autism and mental health diagnoses. how those two things converge and how it might present, what services and supports are in place so that they're able and prepared to intervene. And so it can be a really, really effective preventative measure to go before going to having to call 911 and having more emergent services. And all the CISs around the state are set up to provide that support to MCOT. Each is going to have its own way of making referrals. For us, you can make a referral to CIS either through MCOT, if they're out there. Law enforcement makes referrals to us all the time, but you can also call our call center and ask for these services and they'll reach out to us. And so you also don't have to, so for most IDD services that you receive through a local authority, you have to have a local authority confirmed IDD diagnosis, which means you've come through our intake, you've seen our psychologist and they said, yes, you have IDD. For CIS, you don't need that. You can have a confirmed or suspected, have a diagnosis that's given from another agency. We will provide service. We're probably going to help you get through our intake so that we have your diagnosis on file and maybe help set you up with more robust ongoing services and supports through IDD services as well as mental health services. But it's a really unique and really beneficial team. One thing that I wanted to share, and this is one of the resources that I gave to the Autism Society, who should be able to share it with you guys. This is a one-pager that I created for caregivers. A lot of times as we were first starting out and providing support to caregivers through CIS and our other crisis prevention teams, we were getting a lot of feedback and frustration because they were calling 911 saying that they needed help, or they were calling our hotline saying they needed help, but the hotline or 911 was saying, well, we don't treat autism. Sorry, that's probably what you're going to have to manage as caregiver. And so there was kind of a breakdown in communication. It was a situation where everybody was talking about the exact same thing, but in very different ways. And then there was a disconnect and things were falling apart. So I created this, and this is specifically for acute psychiatric services. So if somebody needs psychiatric hospitalization, this is how we can advocate for it. It's a quick assessment that you can do in the moment. It's information that is really important to share with 911 or MCOT or EMS or anybody else, any other first responder that presents, so that we're very clearly talking about the psychiatric emergency that we're seeing in the language that psychiatric services understands. So I'm not going to go too far into it. It covers a lot of kind of what we talked about earlier about the information that's important to gather ahead of time and to be thinking about in the moment of a crisis. And I believe you should be able to have access to this as well. And you're free to utilize it, free to share it. So here are just some basic preparedness tips and resources. The first thing to do is, so first things first, we talked about early on, gather all that pertinent information, all of that information about the biopsychosocial stressors and factors that can lead to crisis, and then let's put them into a plan. So there are two really important plans to create. The first is a safety plan. Now, this is a very short, one-page at most plan that you develop with the individual. It should really be, when possible, in the individual's own words, their own identified triggers as they see them and as they identify them, the things that help them in the moment as they see and they identify them. Because this is the plan that they're going to use once they start to see their warning signs show up, that there are coping strategies that I need to start utilizing. And so when we're looking at it, we want to look at warning signs, potential triggers. What are some things that you can do in the moment to feel better? And then what are the things that you can do in the moment to feel safe? Because both of those are really important for crisis prevention and for kind of managing when stressors increase. And then a crisis plan. This is going to be a lot more detailed. When possible, we should include the individual in the development of the crisis plan because it is about them. But the crisis plan is really meant for caregivers, for anybody that is providing support to the individual. We're going to want to outline a lot of the things that we outlined in the safety plan, but maybe go in a little bit more detailed with it. What are the specific medical triggers and how do those present? And what are the specific interventions that work or need to be accessed at that point? What are the specific psychiatric, psychological stressors? How do each of those present, and what needs to be utilized? And then same for social. It really helps the caregiver have a plan that if they start to see their loved one or the person that they're supporting start to escalate, now I know how I can help them either prevent, help them start to self-soothe, help them start to access getting their needs met so that they don't escalate further. And then it also can really outline who to call and when. When you see this behavior, give a drink of water. When you see this, because that's a really effective coping strategy, Johnny said it really helps. But when you see these things that are a bit more serious, but are not quite to imminent risk of harm or current risk of harm, that's when you call your hotline. That's when you call your local authority and see if MCOT can come out. But if you see these behaviors, that is absolutely when we need to call 911. Really important to help individuals with autism identify, practice, and modify their coping strategies, and to do so in times of calm. A lot of folks sometimes don't know how they would start to self-soothe if they were to start to become escalated or become uncomfortable. And so it's really important to help them kind of identify, well, when you feel this way, what would help? And then let's practice that and practice it and practice it so that when a crisis does occur, those are readily well-rehearsed skills that the individual is able to easily access. And then modify. Sometimes the best laid plans don't work in reality. So somebody can say, absolutely, deep breaths work for me, but when it actually happened, it didn't work. So it's important after a crisis to kind of review and to look at that safety plan and that crisis plan and those coping strategies and see, did those actually work, or do we need to change the plan and modify a little bit? If your loved one has to go to an ER, so either emergency medical services, fire services, or law enforcement determine that this individual for their safety needs to go to an emergency room or a medical hospital or psychiatric hospital, it's really important that we send information with them and to be honest about the reality of our ability to go with them during a crisis. It's not uncommon for a mom or dad to have, to maybe be a single parent and have other children in the household. They may not be able to just follow the individual to the ER. A lot of times if an individual is residing in the group home staff is not going to be able to leave the other residents and go. So we want to make sure that all that information that we've gathered, that we're sending that with the person as well. Ideally, first things first, we go with them. Second best is that we call the ER and ask to talk to the social worker once we know where they're going. Next is to have a packet ready to go. You'll want a face sheet that includes the contact information for the important people in the person's life, important contact information for the psychiatrist, the primary care physician, current diagnoses, insurance information. And on the right-hand side of here is an example face sheet that we've created that's similar to what we've used in the past. If anybody's like, I don't even know how you create that. If there's guardianship, you're going to want to send that. You want to make sure that that current list of medications is sent with them, because what we don't want to do is to have the ER and the psych facility or the medical facility start piling on medications, because that can lead to future crises. And if there is a safety plan, a crisis plan, or behavior plan, to include that as well. So you kind of go from big to small. So there's that packet, it has all the information in it. That's too much information for first responders when they're first showing up to the door. So one thing that you can use is what's called a first responder information sheet. Very simple, 1 page max. Think about it in rules of 2 to 3. What are the top 2 to 3 pieces of information that this first responder has to know about my loved one or about me in order to help me? It includes communication needs, main diagnoses, triggers to avoid, rapport building strategies. It's really important that officers and first responders know how to start to build rapport with somebody who may be fearful. It might help really keep things de-escalated. And then 2 to 3 de-escalation strategies and contact information. The officer or the first responder may be too overwhelmed by the situation themselves to accept that information in paper form and read through it, but it also gives you something to look at very quickly and say, I need to make sure this officer knows these top 2 or 3 things in each of these areas. Because for caregivers and those of us that support individuals with IDD and autism, we experience the crisis too. And we can become overwhelmed by the crisis and not remembering all the important things that we were needing to share in the moment. So this first responder information sheet can be really helpful for you to be able to provide that information. And then some final thoughts before we can open it up to questions, Jackie. First is know the crisis prevention and intervention resources in your area. Marissa spoke about all the things that are here in Travis County. And if you live in Travis County, these are all available to you. But a lot of these things are available across the state too. It just may mean figuring out who is your local authority and then calling and doing some research ahead of time and then incorporating that information into the plan. Is there a psychiatric emergency service clinic? Where is it? Do they have a CIS team? How do you access it? When you call 911, do you have a mental health option? What are the options when you call? Where's the nearest ER? When at all possible, include the individual in the preparation and the planning. It affects them. They should have their voices should be centered in what are their triggers, what are their warning signs, what are the things that work for them and could help them. And then practice. When crises happen, even the most well-rehearsed skills, the most practiced skills can start to fade away because we're so overwhelmed with what's going on. But the more we talk about it, the more we prepare for it, the more we kind of practice those skills, the more likely we're going to be able to access them quickly, even when things are intense. One thing that I wanted to leave you with, and I don't have a whole lot of things outside of kind of what I shared, but the next step is to start practicing these things with the individuals. And our CIS team and our crisis prevention teams do practice these things. Let's practice coping skills. Let's practice creating safety plans. Let's practice, identifying what an officer looks like versus EMS versus MCOT. If you are looking for resources on curriculum or activities, skills training things, our staff really heavily rely on Pinterest and Teachers Pay Teachers. You can find a lot of really good resources, things that you can print out, things that are free, so that you can start practicing these things in a way that is most accessible for your loved one. And then that's it, Jackie. I think we're ready for questions.
Okay, excellent. Thank you so much for all this information. It's been really helpful. And Leslie, who is our social worker here, has been putting up the documents. So we have the PowerPoint and the documents that you guys have been discussing in a link on our website, and Leslie shared that link. But if anybody's watching and can't find it or needs help, definitely feel free to email us at support@Texas Autism Society, and we'll guide you to the presentation and to how to find the documents that they've been talking about. But we have a couple of questions. One is, let's see, in what sort of circumstances will MCOT respond? And another MCOT question was, how long it might take for MCOT to respond in general?
Sorry, I had to plug in so I didn't lose everybody.
No
Great. Those are great questions. So MCOT responds so it's pretty wide open. But really what we're looking at is have you or has somebody identified that someone is experiencing a crisis? And so crisis looks different for everybody. So that can be someone who is having thoughts of suicide, who is having thoughts of homicide, who may have just experiencing a significant stressor that's, and that could be anything: loss of a loved one, loss of a relationship, loss of a job, and they're having a difficult time coping. Maybe someone who's not been able to get connected to medication services and are in need of that, but don't have the financial ability to do so. It could be someone who their level of aggression or agitation seems to be increasing related to their a diagnosis, whether that be mental health or IDD or autism, and just needing additional support and intervention in that moment because they've hit a threshold where they're unable to utilize their coping skills to kind of maintain their safety in the community. And I would say any of those would be appropriate for MCOT to go out to. The only referrals that we are not going to are those where there is imminent risk of harm to somebody. So if there is an imminent risk due to violence, either self-inflicted or towards somebody else or in the community, that would be more appropriate for 911 to go. We're really intervening when the environment and the person is in a safe place, because we don't want to delay that for them. The only other times that we are it is not appropriate for us to go if someone is under just like the medical emergency or level of intoxication, where it would be inappropriate for us to delay medical assessment or specifically for substance use if the person doesn't have the ability to engage in safety planning or a meaningful assessment. Those would not be appropriate for MCOT at that moment. But other than that, if you or a loved one has identified that there is a need for MCOT services, you're certainly welcome to call 472-HELP and discuss those concerns and request MCOT specifically. I do want to also just emphasize the more information you can provide at the hotline call as well as 911, the better it is for the response to happen. So the risk factors, what's currently happening at the moment, what could potentially happen if there is a continued delay response. Looking at all of those factors and providing that information is going to be extremely beneficial as we triage in both systems, the 911 system and in the crisis hotline system, about the response time for first responders and or MCOT clinicians. For the MCOT clinicians, the times that we respond is varied. The response times, it really depends on the volume of calls that we're receiving at any given point in time during the day. I mean, sometimes traffic patterns delay response. So what I can tell you is we get out as quickly as possible. As soon as we get a referral, our clinicians are triaging cases. Again, like I said, the more information you can give to us so that we can determine the level of risk and how quickly our response will be is going to be really beneficial. You can also request an estimated time of arrival. When you call the hotline and request an MCOT referral, the hotline is a separate team from the MCOT team. So they do not have the knowledge of where the teams are at in their dispatches. If they're done with assessments, they're just intaking the information and sending it to the MCOT team. So when you request an ETA, the hotline will then provide that request to the MCOT team, and then someone from the team will call you back to provide you with a realistic time frame of when they'd be able to respond. I also encourage you, if anything changes, as things do happen in crisis situations, crisis is very dynamic. If you need to call 911 before MCOT responds, you can always call the hotline and let them know that that happened. Or if a behavior has intensified and it's still not meeting that threshold of imminent risk of harm or immediate risk, please call us and give us updated information, because again, that could help provide us information about how quickly we need to go based on all of the referrals that we have that day.
Great, thank you. That was really helpful. Another question we've got some questions from a couple of autistic adults and adults with disabilities who are out in the community. And one asked, I don't know how you guys feel about this, but they said, how do you feel about the communication impediment on a driver's license and license plate laws? So there's definitely, for those that don't know, you can get communication impairment or impediment on your license. So I know not everybody is aware of that. But they asked, how do they feel about that? And then I also wonder, depending on, I know we've got mixed feelings here about, do people want to disclose that? Is it on your license all the time? Is there privacy violations and those kind of things? But then as you guys were talking about the first responder information sheet, I also wondered if you recommend that for adults with disabilities who are out in the community independently. So what are your feelings about those two things?
Yeah, so as far as whether or not you put it on your driver's license or official state document, I think that has to be a personal decision and what you feel comfortable putting on that. That is not the end all be all way to share that information. Like we said, having a readily available, maybe even half sheet, smaller sheet, laminated little card with maybe the really just true top 2 or 3 things that you need to share might be plenty. We've had somebody that wore like a lanyard with just a little card tucked into it that shared that information on it. We've had people that did carry around first responder forms with them folded up in their wallet and things like that. The main thing is getting that information across, because a law enforcement who sees an individual with an autism diagnosis possibly just navigating the world as somebody with an autism diagnosis, maybe engaging in stimming behaviors or talking to themselves or listening to music because that's what's comforting to them. They may not see on the front end that this is somebody with an autism diagnosis, and therefore I need to kind of explain maybe their behavior through that lens a little bit while also exploring other things. But really, so that we talked about diagnostic overshadowing. In the criminal justice field, the diagnostic overshadowing is criminality. So every time they show up to an encounter, sometimes that's the first thing that they're thinking about. So the more information we can share that sheds more color, more information, more kind of nuance to what's happening, the better that encounter is going to be. I do the training on IDD with law enforcement, including autism, and we talk about stimming. And what that looks like and what that means and how important it is to many individuals with autism to be able to engage in that behavior, that it is a self-soothing strategy that is incredibly effective. So stopping that person from doing that may not work out. But if they don't know that that's autism, and the stressor of the situation at hand, they may be explaining that behavior that they're seeing through their lens. So we want to make sure that they're seeing the whole person too. It's up to you, again, back to the driver's license and state forms, whatever you feel comfortable with. But I do think that it is really important information to share in whatever way you feel comfortable and ready to do, and that it's easy and accessible for you to do so.
Great. Yeah, that's kind of our feeling as well. So yeah, you have to kind of make your own decision on that. If you're out in the community with being independent. So okay, thank you. And then I think we really just have one last question, but and this is something people can contact us with as well if they're having problems accessing their mental health services in their community. But somebody asked, if you can't get what should you do if you can't get adult mental health or IDD services in your county?
So that's difficult. I do think figure out if your county has a CIS team and see if they can assist you with that. Because again, if you have an autism diagnosis, you're absolutely eligible for CIS. You don't have to have one, and you don't have to have one through our agency to access those services. But that CIS staff can help you with seeing what resources are available in your area. They can also help with increasing the likelihood of access by breaking down that barrier that diagnostic overshadowing happens. That a lot of times a clinician or mental health providers may think, well, I don't treat IDD, I'm not the right person for this. They can provide trainings on improving services to the population, help to kind of break down that diagnostic overshadowing and help the clinician see the whole person. And they can really help kind of navigate through some of these complex and bureaucratic systems that might be at play. That would be my first very important recommendation. And I do know that, especially as we're talking across Texas, some of the more rural counties may have a more difficult time, but most of the areas do have local mental health authority services, which are accessible to anybody who is eligible for them, regardless of if they also have an IDD or autism diagnosis. And so CIS can kind of help with that advocacy and access too.
Great, great. Yeah. And also, like you guys said about the language, your handout about what to say to access services. I think if any families or autistic adults are struggling, like they've tried to contact their local mental health agency and then they're not getting services, you can also contact us and maybe we can see what happened or where the, where the disconnect was between.
Is it the same thing where we're talking about the exact same thing, but in two different ways? And we're not really sure how to kind of marry the two. And unfortunately to access, not unfortunately, but the reality to access psychiatric services, we have to know how to speak their language and to also define what we are seeing and what we're experiencing in a way that they can understand and see a point of intervention for.
Yeah. And so we're happy to, obviously y'all, this presentation is going to be a great resource for people, but if people are still struggling, you can definitely contact our team and we can walk you through like what to say and who to contact. And especially we've got a lot of information for Travis County, but we can help you with your, all the other counties in Texas. And like both of, Marissa and Sarah said, we want to have everyone, you want all this information in advance, right? You want to find your local crisis number, be prepared, practice. So we hope everyone will take that away and kind of look into what your local services are as well. And I think that's really about the end of our questions. Do you guys have anything else, Marissa or Sarah, that you want to add or?
No, thank you so much for having us.
Yeah, this has been really helpful. I'm just gonna, if y'all can stop sharing, I'm gonna go ahead. I'm gonna try to share my screen if I can, because I just wanted to make a couple more announcements about our next presentations. Let's see. So let's see if I can, there we go. So yeah, so our next, we've got a presentation coming up September 22nd on healthy relationships. We've got panelists from Safe Austin, as well as some autistic adults on the panel. Our very own Amy Kellogg will be moderating this. It's going to be a really, really good discussion. So that is 7 p.m. on the 22nd. And then we also just wanted to mention our Autism Film Festival is coming up really soon. It's right around the corner, October 23rd. And we have an early bird discount sale on right now. And that event's got short films by autistic adults, feature film. It's a documentary about 2 young adults with level 3 autism. Their brothers and their life and seeking services and everything else. And then we're going to have a really great panel discussion about services and supports and creating a meaningful life with, especially when we have like level 3 and high support needs. And those, we don't always get to see that in films. And so we were excited to see that documentary and we'd love to have you all there. So I'm going to stop sharing now, but I just wanted to let everyone know about that. And I think we can wrap up, but please, if anyone has questions, please email us, contact us. All our information's on Facebook. And if you have questions for Sarah, Marissa, we can definitely get them over to them. All of their documents are on our website. So we hope you guys have learned a lot. And Sarah, Marissa, thank you so much. We really appreciate you guys doing this today. And thanks for your time.
Thank you. Thank you for having us.
All right, thanks. All right, I'm going to